हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन। आज हम डिस्कस करेंगे मेडिसिन के सम इम्पॉर्टेंट एमसीक्यू। एरिया ऑफ डिफ्यूज अनकोऑर्डिनेटेड स्पैज्म इन सेवरल esophagus segment and simultaneous multi-peak contraction are evident. Further evaluation is most likely to show which of the following: diffuse esophageal spasm, upper esophageal wave, eclasia, and scleroderma. Here the best answer is diffuse esophageal spasm because the non-progressive dysphagia is seen in the choice A and choice B, while choose C and D have progressive dysphagia. Here the patient had dysphagia to solid and liquid, and his esophagogram shows diffuse uncoordinated spasm along the esophagus. These findings are suggestive of distal esophageal spasm. What? Distal esophageal spasm. Next question. A 40-year-old female presents to recurrent epigastric pain and chronic diarrhea, which has been taking proton pump inhibitor for an extended period. The primary reason for her diarrhea is explained by gastric hypersecretion leading to an acidic pH in the duodenum. This in turn causes the inactivation of pancreatic enzymes, leading to unabsorbed sugar mucosal damage secondary to increased hydrochloric acid from the stomach. In response to elevated gastric levels contribute to the symptoms. What is the drug of choice for managing the underlying gastric hypersecretion and healing ulcer in the patient? Injection lanreotide, H2 blocker, antacid, and PPI, proton pump inhibitor. Here the best answer is the proton pump inhibitor because here the what Zollinger Ellison syndrome, which is characterized by gastric hypersecretion due to gastrioma. The drug of choice for managing what? The underlying gastric hypersecretion and healing ulcer is a PPI, proton pump inhibitor. PPI reduces what? Gastric acid secretion. Reduces the gastric acid secretion by inhibiting the proton pump in the gastric parietal cells. Next question. A 45-year-old male patient present to the emergency department with complaints of vomiting blood after a night of heavy drinking. He reports multiple episodes of itching prior to the onset of vomiting. On examination, his heart rate is increased and his blood pressure 100 by 70 mmHg. What is the most likely diagnosis for the patient presentation? Mallory Weiss syndrome, esophageal varices, peptic ulcerations, and acute gastritis. Here the patient the history of a heavy drinking followed by the reaching episode and vomiting blood is characteristics of Mallory Weiss syndrome. This syndrome involves a what? Submucosal tear. Submucosal tear. Where the near the lower esophageal sphincter, near the where lower esophageal sphincter, often is the triggered by the excessive alcohol consumption by severe vomiting seen in hyperemesis gravidarum. कहाँ पे दिखता है? hyperemesis gravidarum. If the presentation typically includes hematemesis, reaching, and possibly vasovagal syncope, examination finding of increased heart rate and hypotension are consistent with acute blood loss. क्या होता है consistent? Acute blood loss. Consistent. Next question. A 45-year-old male presented to the emergency with a complaint of chest pain associated with swallowing a piece of meat. He reports similar episode over the past 3 years. However, today's episode was the most severe. He does not give a history of regurgitation other than these episodes or heartburn symptoms. There is no difficulty in liquid intake and he has not had any weight loss or probable diagnosis in this case. Scotty ring, adenocarcinoma of the esophagus, eclasia, and pulmonary Wilson syndrome. The best answer is the Scotty ring because the B ring is a thin membranous narrow part present at where squamocolumnar mucosal junction कहाँ पे होता है? स्क्वामोकोलुमनार म्यूकोसल जंक्शन present in about 10 to 50% ऑफ पीपल। और कहाँ पे होता है ये? क्या होता है? मोस्टली एसिम्टोमेटिक होता है, ऑन स्कैटरिंग वेन ल्यूमन डायमीटर, ल्यूमन का डायमीटर कितना होना चाहिए? लेस देन 30 mm। एसोसिएटेड विद एपिसोडिक सॉलिड फूड डिस्फेजिया। क्लासिक सिम्टम्स, द टिपिकल एज ऑफ प्रेजेंटेशन कितना हो जाए? मोर देन 40 years। and the intermittent food impactation is also known as stick house syndrome as a Neet-Pg typical inhibitor। यहाँ पे stick house syndrome में Neet-Pg typical inhibitor। ट्रीटमेंट डायलेशन ऑफ द esophagus। ट्रीटमेंट क्या है? डायलेशन of the esophagus। Next question, a patient present in OPD with symptoms of anemia, acute abdominal bleeding, tired stool and vomiting with blood in it, endoscopy show strips of watermelon on stomach was which of the following condition leads to the following endoscopic appearance? Intestinal lymphangiectasia, gastric intravascular ectasia, amoebic colitis and necrotizing enterocolitis। Here the best answer is the gastric intravascular ectasia, because the gastric intravascular ectasia Gave syndrome, also known as the watermelon stomach, is a significant cause of acute or chronic gastrointestinal blood loss. In the elderly, it is characterized endoscopically by watermelon strips. Although it is associated with heterogeneous medical condition including hepatic, renal and cardiac disease, its pathogenesis is unknown yet. What is the diagnosis of Gave disease? The diagnosis of Gave disease is patient with renal or hepatic disease is often problematic because these are more frequent causes of gastrointestinal bleeding in this disease, and vascular malformation, peptic ulcer disease, peptic ulcer disease in the bleeding and vascular formation, gastric varices, colonic and rectal ulcers that overshadow of the Gave syndrome, and the gastric intravascular ectasia is equal to vascular information. क्या होता है vascular information? Watermelon stomach. So today that's all, and keep revising. Thank you.